Good afternoon. Thank you for joining us today for Planning Ahead for the Care You May Need, Healthcare Decisions in the Era of COVID-19. I'm Calvin Hu, Education Coordinator at Family Caregiver Alliance, and your co-host. Planning Ahead for the Care You May Need is part of a series of webinars focused on caregiving during the COVID-19 emergency. These webinars are a collaboration between Family Caregiver Alliance and the San Francisco Department of Disability and Aging Services. Now, if you haven't heard about Family Caregiver Alliance, briefly, we do research and advocacy for caregivers, as well as offer some support services. We have a number of fact sheets, webinars, blog articles, and online classes for caregivers. We also offer direct services and counseling to family caregivers in 5 counties of the San Francisco Bay Area. So now I'd like to turn things over to today's co-presenter, Luciana Tsai, at the San Francisco Department of Human Services, specifically the Department of Disability and Aging Services.
Thank you, Calvin. And I'd like to also thank the Family Caregiver Alliance for taking the time to co-sponsor these educational webinars with San Francisco's Department of Disability and Aging Services. The goal of this webinar series is to provide education and information to service providers, caregivers, and recipients of caregiving to support them in sheltering in place and staying safe during the COVID-19 pandemic. The presentation today is the last of the series. For more webinars, please visit the Family Caregiver Alliance's online calendar. Recording for today's presentation will be posted at the Department of Disability and Aging Services webpage and the Family Caregiver Alliance's webpage. Now, 2 distinguished University of California, San Francisco doctors are here with us today. I will start with presenting Dr. Rebecca Sudore, a geriatrician, palliative medicine physician, and clinician investigator. She also directs the Innovation and Implementation Center in Aging and Palliative Care and the Vulnerable Populations for Aging Research Core of the NIA-funded Pepper Center. Dr. Sudore conducts research to improve advanced care planning and medical decision-making for diverse, vulnerable adults. To this end, she has designed, tested, and disseminated innovative patient-centered tools, including an easy-to-read advanced directive in over 10 languages and an interactive advanced care planning website called Prepare. Dr. Sudore is co-presenting today with Dr. Ann Kinderman, Associate Clinical Professor of Medicine at the University of California, San Francisco. She is the Director of the Supportive and Palliative Care Service at Zuckerberg San Francisco General Hospital. After completing her internal medicine residency at UCSF and Hospice and Palliative Medicine Fellowship at Stanford, she returned to Zuckerberg San Francisco General in 2009 to help develop the Supportive and Palliative Care Consult Service as its founding director. Dr. Kinderman's scholarly work has included developing a curriculum in palliative care interpreting for professional medical interpreters, promoting high-quality care for vulnerable patients with serious illness, and expanding palliative care services in safety net health systems. Within the American Academy of Hospice and Palliative Medicine, she helped to create and served as the founding chair of a special interest group focused on the healthcare safety net, which advances collaboration and scholarship among palliative care providers caring for vulnerable patients. In 2014, she received a Sojourn Scholars Leadership Award from the Cambia Health Foundation to support her development as a leader in palliative care, and was subsequently named an Aspiring Leader Under 40 by the American Academy of Hospice and Palliative Medicine. Please welcome Dr. Sudore and Dr. Kinderman.
Great, well, thank you so much for having us. It really is an honor to speak with you today. Ann and I are very committed to thinking about practical solutions for real people in the real world. And today we want to talk about planning ahead for the care you may need, healthcare decisions in the era of COVID-19. We're both going to give our presentations, and then we definitely hope to save time at the end so that anyone can ask questions. So I'm going to start by talking a little bit about advanced care planning, what the goal of advanced care planning should be, how advanced care planning may be a little bit different, during the COVID-19 crisis, and then some practical free tools that people can start using right now to help them think about their care. And then Anne's going to take it over and talk about palliative care. She's going to talk about what being in the hospital is like with COVID, some key things to consider, and how palliative care can help. So I'll start by talking about what we mean when we say advanced care planning. I think people often think about just advanced directives, but just to let people know that a large group of experts in 2017 came together to define what we really mean when we say that. So the definition is that advanced care planning is a process, not a one-time event, that supports adults at any age or at any stage of health in understanding and sharing their personal values, life goals, and preferences regarding current as well as future medical care. And really the goal of advanced care planning is to help ensure that people receive medical care that is consistent with their values, goals, and preferences during serious and chronic illness. So you'll notice again that this is a process. It's meant to be something that is ongoing and that happens over time as people age or as people's clinical context changes. And the goal really is that we as medical providers really want to give care that is consistent with people's values. So why is advanced care planning important, you might ask? Well, a lot of research has shown that if people do advanced care planning, people and patients are more satisfied with the care that they get. They actually report improved quality of life. People get less unwanted medical care, and they get care that's aligned with their wishes. And many studies have been showing that there's a lot less stress for family members, what we call surrogate decision makers, or someone who might have to make decisions for someone else. So what are the advanced care planning realities? Well, we know that only about a third, or 33% of people, engage in advanced care planning, and this really hasn't changed in the last 10 years. And we know that among diverse populations, this is even lower, somewhere around the 15 to 20% range. And when we actually ask people, well, have you talked to your medical providers, your doctors about this? Only 10 to 20% say they've actually brought it up or talked to somebody about it. And sadly, I think what we have recently found that even for those people that die in the ICU, up to 20% of them don't have any advanced care planning wishes in their medical record before death. And I think when we think about COVID and the clinical realities and why advanced care planning and maybe thinking ahead is so important, there's some things that are maybe a little bit different about this. One of the things that we know is that it's a serious illness that can affect both young adults and older adults. And actually the median age is 56 years. So I think in the beginning people thought, well, this is only older adults, but that's really not the case. We also know that somebody's clinical picture can worsen very quickly and can be in a situation where maybe they can't speak for themselves. And so again, why advanced care planning might be very important in that situation. Sadly, because of all of the restrictions and trying to keep people safe, families and surrogate decision makers are not able to visit the emergency room or the hospital. And again, when you think about the people in your life that might be able to advocate for you, they might not be able to be there. We're also finding that older adults in particular are not bringing in hearing aids, glasses, sometimes cell phones or chargers that have all of that important information to call loved ones. And that can be, particularly challenging. And what we're finding is that frontline providers are really desperate to know any information about people and the family contacts when they come to the emergency room with COVID. So one of the things that we have heard from people around the country is that they wanted some practical tips and some things that could help them think about, well, how do I do some of this preparation? And so a bunch of organizations with our organization came together to create this campaign called COVID-19 and You, Be Prepared, Take Control. And this is really focused on 3 steps, and I'll go over this in a little bit more detail. But 1 is to have a hospital, what we call go bag. 2 is to think about choosing a medical decision maker and who that person might be that can advocate for you and speak up for you. And 3, to share your wishes and encourage your loved ones to be prepared. So I will just say on the Prepare for Your Care website, if you go there, it's again right there, Prepare for Your Care. The Be Prepared, Take Control campaign is right on the homepage. If you click on that, it will take you to a page that has these little videos that you can watch about putting together a go bag. And it also has these free COVID tip sheets that you can download for free and use for yourself or for other people in your organizations. And it really is focused on some main topics, such as plan for medications, including keeping a list of your medications on hand. Planning again for what would go into your hospital go bag. Well, things like writing down somebody's phone number in case your cell phone dies or we don't have that information, including the list of your medications. And if people do use hearing aids, glasses, or have dentures, to include those things, as well as your phone and phone charger. And if you have them, any advance directive documents. We'll talk a little bit more about that. And I think that's one of the things too, that in thinking about planning for your medical wishes, as we were saying before, that probably the number 1 thing that you can do is think about who might be that advocate or that medical decision maker who could help make medical decisions if you're not able to. That's probably the number 1 important thing. And I would say to follow that up is we can't assume that people will know that you chose them. So it's really important that you then reach out and say, hey, will you do this for me? Sharing your wishes, like I said, about whether, who's going to be your, decision maker, or if you've completed an advance directive is really important. And if you consider an advance directive, I'll tell you in a moment about some free, easy to use advance directives on our site. Some of the other things on this COVID sheet include what you might think about if you need to plan for your pets if you were in the hospital, or how you might plan for your money and bills if you were in the hospital. And now I wanted to tell you a little bit about our advanced care planning website called Prepare. This is in English and Spanish. Just to tell you before that we had created easy to read advanced directives, we had done some studies showing that people overwhelmingly preferred this easier form, really regardless of their literacy level or the language, and that these forms are actually available in 10 different languages in California, and they're on the prepareforyourcare.org website that you can download them for free. But we found that there was a missing puzzle piece when we think about, again, just the advanced directive, and then we think about what we're really trying to do with advanced care planning, which is to make sure that we honor patients or people's wishes and values. And really the only way that we can do that is if we hear about people's wishes and values from them. So we really learned from talking to people in the community that that missing puzzle piece was really helping prepare people with the skills that they need so that they can identify what is most important and how they want to live, how to talk with family and friends, how to talk with medical providers and make informed decisions so that they get the care that's right for them. And that's really what we wrapped into the Prepare website. So again, that's prepareforyourcare.org. And there are 5 steps. You don't have to do all of these 5 steps. You can pick the steps that work best for you. 1, choose a medical decision maker. 2, decide what matters most in life. 3, choose flexibility for your decision maker. 4, tell others about your wishes. And 5, ask doctors the right questions. So in creating Prepare, I'll just tell you very quickly that it's easy to understand and meant to be written at a 5th grade reading level. It has voiceovers and closed captioning for people who might have difficulty hearing, again in English and Spanish. And we tried to have a range of video stories. Some people have access to family members and surrogate decision makers who can make decisions for them. And some people are still thinking about that or might not have access to those folks. And then some people have different views on decision making, meaning some people will say, like, you know what, I don't really want to make my own medical decisions. I want my family to do it. So there's some special information about that. I think the real cornerstone of the website, though, are these videos. So these videos that show people how to do something. We didn't want to just say, hey, do it. We wanted to say, look, this is really how you could do it. So how would you ask somebody to be your medical decision maker? How do you talk to your family and friends about your wishes? And how do you talk to your clinicians and doctors and ask the right questions so you can get the medical care that's right for you? As people go through Prepare, they answer some questions about their values and preferences, and the site will automatically create a summary of your wishes and values for you. And if you're ready, it will automatically populate them into a California Advanced Care Healthcare Directive. And I'll talk a little bit more about that. Just to tell you that we've done a lot of studies about the Prepare program, including 2 randomized control trials that included 1,400 English and Spanish speaking patients, including people here in San Francisco and at San Francisco General Hospital. And we found that after people reviewed the Prepare website and our easy to read advanced directive, 98% of our sample were able to engage in some form of advanced care planning. And when we looked in the medical record, we were able to increase the documentation from 8.5% to 43% at about 1 year. So if you go to the website, prepareforyourcare.org, on the very face page, you will see that there's a section for advanced directives. And you can click on that and get your own advanced directive. So these easy to read advanced directives are actually in English and Spanish, and they're actually available for all 50 states. Not just for California, but California actually has them in 10 languages. So that's sort of special for California. I wanted to let people know too that these advanced directives may be different than some of the forms that you've seen before, because we really focus on values and space so that people can write down why they made their decisions. We focus on things like quality of life, and what brings people quality of life, what things might be hard on somebody's quality of life, other things that might be important to people, like their pets or music or things that they want, with them. And then there's space for people to write, again, any other specific wishes that might be important to them. That might be related to the COVID-19 crisis, or it might be related to other wishes, such as dementia or something else that might be particularly important for you to let your doctors and your medical decision makers know. In the Prepare website, we actually have a little button that says My Prepare Advanced Directive. This will help walk people through actually how to complete the form if that's what you want to do online. If you don't want to get it and print it out and have a paper form, it will actually guide you through the process. So the website looks exactly like the printed form, and if you see these little question marks, you can click on them and it will pop up extra information that might be helpful. It might be words and text, or it might be something like this, like a video that might help describe what this section is about. Again, if you decide to go through the entire Prepare program and one of the steps, and it asks you about your values and goals, if you answer any of the questions, it will automatically populate your advanced directive for you, so you don't have to do that again. Just to let folks who are on the call who might be at some organizations that there's some other tools that might be helpful. And again, you can get this right on the face page, and these are all free. There's the Prepare pamphlet that gives some basic information about the website in English, Spanish, and Chinese. There is also an ability to show the Prepare website content like a movie. There are toolkits for how to put on group movie events. And I think that we're realizing in this sort of COVID time that there are ways to do these group visits through video. So something like Zoom, like we're watching now, you can actually play the movies and it will play for you. And I'm happy to talk more about that. So just as a reminder that for COVID, we have this making a medical plan during COVID-19, and organizations can use that as well. And for organizations who are thinking, well, how can we help the people who work for us maybe learn how to start having these conversations with our clients, I just want to point you to one of our free resources, which are called Simple Advanced Care Planning Scripts for all outpatient. This says healthcare professionals, but we know that other folks are using them too. And this again makes it very simple and breaks it down about asking a surrogate, asking about prior advance directives, and really gives some basic information about how you would tell people about an advance directive or about any of our prepared materials. And that's sort of what that looks like. And again, this could be really any healthcare professionals or someone who works at your organization. And so with that, I'm going to end. And then Anne was going to ask me just a few of these questions, which we thought might be helpful to you before she starts her presentation.
Yeah, thanks so much, Rebecca. It's all really incredible, all the resources that you and your team have put together. And I think one of the things that's so powerful about Prepare is the thoughtfulness that's gone into making it really accessible. So really one of the most important things is figuring out just where people start with the process. So if you could talk a little bit about that.
Yeah, I mean, I think the simple answer is, this can be sort of all overwhelming. And it's sort of like, what do I do? I think the number one place to start is just thinking about who that medical decision maker would be. And if you go to the Prepare website and you just click on step one will walk you through that whole process to do that. And so I think that's where I would tell people to start.
Great. And you mentioned that there are all of these terrific resources that are on the Prepare website. You've got COVID tools and things that help individuals create their go bag. You've got a movie. How do different organizations use these tools?
Mm-hmm. Yeah, I think they use them in many different ways. And I think it's really sort of up to the organization and how that works best for them. So for some groups who are already doing these group movie events in the community, it was really easy to then move that into some of the Zoom meetings that they've been doing, like I said, just like this one. Other groups have been mailing people information about COVID, and they really liked our COVID sort of medical planning guides because they can include that, with their, for their clients. But just to say, all of these materials are free, and people can, feel free to sort of pick and choose the ones that work the best for them and their organizations.
Great. Thanks so much. And for sure, if there are more questions that came up for anyone during Rebecca's presentation, feel free to put those in the Q&A or the chat, and we will do our best to try to get to them at the end of the hour. So what I'm going to be talking about is specifically about palliative care, and I'll describe, if those words are unfamiliar to you, that is no problem. I'm going to get into that. I'm going to talk just pretty generally first about what it's like to be in the hospital right now, whether you have COVID or not. Talk about the things to think about if you are thinking and worried perhaps about what would happen to me if I had COVID. And then to talk more specifically about this type of care called palliative care and why and how it might be helpful. Next slide. So shamelessly, this is where I work, Zuckerberg San Francisco General. And so I put a picture here under normal circumstances where people are not physically distancing or having masks on. But to just give you a sense of if you got sick for any reason, whether that were COVID or whether that were a regular medical illness, and you had to go to the hospital, or if you had to go to the hospital because a loved one was there, what would you expect? Next slide. So for those who haven't been there, the hospital is a really weird place, actually. It's kind of like its own little world. And there are some unique things about being in the hospital, as Rebecca mentioned. So that the new things that people experience who are in the hospital now is it, there just are fewer people who are around. There are, like other places of work, there are more people who are doing things remotely. So there are fewer people around. And so it's often less noisy than it often can be in the hospital. So Rebecca mentioned visiting is very limited in most hospitals. So you can expect in a regular hospitalization that you actually won't be allowed to have visitors at all. Staff that come in will be wearing masks and sometimes face shields, even if you don't have COVID. And that's for the same reasons that it's recommended in San Francisco and many places that you wear something to cover your face to prevent you from making someone else sick in case you don't know you're sick, and also to help protect you from getting sick from other people. Some of the providers and staff that come in or that help care for you in the hospital, you might only meet with them by phone or video, actually, because as I mentioned, we're all trying to be careful about using personal protective equipment right now and staying safe as the healthcare professionals who are on the front lines. We're trying to prevent people from getting sick. The usual things that still exist in the hospital, if you've been there before, you can expect as a patient that staff are going to wake you up at all hours of the night sometimes to ask you questions, to draw your blood, to examine you and things. And so it's actually, unfortunately, not a great place to get rest. But the more and more people are really only in the hospital when they're very sick and their needs can only be met in the hospital. You can expect to have a doctor or an advanced practice provider, like a nurse practitioner or a physician assistant, come see you daily. And usually, actually, you only see those people once a day. They come in to check in on you and then maybe doing a lot of work behind the scenes, but you won't see them again. And then the last thing I'll say is that results can take some time to get back. Some results are really quick. And some results might take days, actually, to find out. And so you can always ask your doctor or your healthcare professional about when we can expect to get those results, but just know that it varies. Next slide. So I want to say, I know that there's a lot of anxiety out there. I feel it myself around what would happen if you were to get COVID. The first thing I want to say is that the vast majority of people who are infected with COVID actually don't even need to come to the hospital. So we know that it's about 80% of people who get COVID don't need to come to the hospital at all. They might feel bad. They might feel nothing. They might feel bad, but they stay home. So for only about 20% of people, they get sick enough that they need to come into the hospital. For people who do have to come into the hospital, most of those people don't actually need invasive treatments. Because COVID is pretty infectious, it's contagious, there are special isolation units in the hospital where staff have extra protective gear on, and there's kind of heightened protections against spreading infection. You may experience that most or all of your in-person visits from healthcare professionals might be just from one single doctor or nurse practitioner and one bedside nurse. And then other visits, like from a chaplain or from a specialist, they might actually be by phone or video. And again, that is largely to help protect healthcare professionals from getting sick and also to preserve our personal protective equipment so that we have enough to stay safe as healthcare professionals. If you need extra support like oxygen, it's usually provided, like in this picture, with a device called a nasal cannula. It's a small tubing that goes into your nose and provides some extra oxygen. There'll be close monitoring of your vital signs and your blood tests to make sure that things are going in the right direction. Again, you probably are not going to have any visitors, and a lot of hospitals are trying to help patients get connected by phone or video. If you don't have a phone or tablet, they're trying to do their best to help make that happen. And then once you're out of the high-risk period of your course with COVID, you're able to go home and finish out your quarantine period, which is about 2 weeks. And in San Francisco, if you don't have an ability to quarantine yourself because of your living situation, we actually, in our Department of Public Health, have special isolation accommodations. Next slide. So for the very small proportion of patients who get very, very sick with COVID, of all the people who get COVID, so this isn't 3 in 100 people in the US, it's the people who just have COVID, 3 out of 100 of those people need to get intensive care. Most of those people are in intensive care because they need what's called mechanical ventilation or a breathing machine. Sometimes it's how healthcare professionals talk about it. It's a tube that goes into your throat and helps to connect you to a machine that gives a lot of extra oxygen and sometimes pressure to keep your lungs open. That is an uncomfortable thing to happen sometimes, and so oftentimes patients have to actually be sedated with medications to get enough oxygen and just to be comfortable enough on the ventilator. So people are often asleep and not able to interact. The doctors, if you're in that state where you're not able to speak for yourself, they would be communicating with your designated decision maker, like Rebecca was talking about. And in terms of what happens to people, some people for sure get better, and some people get better relatively quickly. Some people get better, but it takes a long time. And unfortunately, some people get so sick that they die. And your chances of dying from COVID-19, if you get a really severe case, go up as we get older. Next slide. So piggybacking off of what Rebecca was talking about earlier, I think because we know that when people get a very severe case of COVID, they can get much sicker much faster. And so it's really good to be thinking about these things before you actually get to the hospital. And I completely agree with Rebecca that the number one thing to think about is who you would want to make decisions for you. And if possible, make sure that that person knows that they're the person that you would want. And then the other big thing to think about is if you were to get sicker very quickly, which approach to your care really feels like it fits you. And this is something that you can go through if you go through the Prepare website. So there are 3 main categories of approaches to care that I think are good to consider. One is for some people, they say, you know, life is important to me and having as long a time as possible is my main priority. And even if that means that I'm not able to communicate or I'm not able to take care of myself or I'm not able to go home and I need to live in a nursing home or a medical facility, some people say that is really important to me because living as long as possible is what's most important to me. Some other people would say, you know, I would really want the doctors and nurses to give a really good trial of life support and other potentially invasive treatments, but I wouldn't want to be on life support or machines for a long period of time, or I would only want to continue treatments if I could get better enough to go home or to take care of myself or to feed myself, those sorts of things. And then lastly, there are people who decide, you know what, invasive treatments are just not for me. I may have had to have them before, other illnesses, and it's just not what I want right now. And so those people choose to get treatments that are non-invasive, like that oxygen by the regular small tubing, and medications to help relieve your symptoms. Next slide. So some questions that you may want to think about just in general to prepare and think about what's important to you. So, you know, thinking ahead for COVID, what would be most important for your healthcare providers or your loved ones to know if you became very sick and you couldn't speak for yourself? What are the things that are most important to you in life, and what would you want to say to them about your care? I think it's really helpful as a doctor who's treating very sick patients, the second question about what abilities are so important to you that you can't imagine living without them, because those really speak to us as healthcare professionals around what are we aiming for? What are we trying to get you back to? What are the things in life that make life really good for you? If you became very sick with COVID, how much are you willing to go through for the possibility of having more time? There's some people who are willing to go through a lot of sometimes uncomfortable procedures for even a small chance of more time, and other people are not willing to go through invasive treatments at all. So it's good to think about this. And who in your life have you talked to about your priorities and your wishes? If you've identified someone as your decision maker, how much does that person know? How much does your primary care doctor or other specialists you work with know? And then I think it's great to think about what gives you strength in hard times, because it can be difficult being in the hospital. And so it's helpful to think about what will help your spirits stay up when you're in the hospital. Is it music? Is it spirituality? Is it communicating with your family? What helps you get through so that we can provide that for you in the hospital? Next slide. So lastly, I want to just talk about palliative care. And as I said, most people that I meet have not ever heard of palliative care before, so I like to just explain it. So palliate is actually a word, comes from a Latin word for a cloak, and it's something that, we put on if you're going out like into the cold to protect yourself and to feel better, not feel cold. And so palliative treatments are treatments that help relieve or reduce the suffering that comes along with a serious illness. It doesn't aim to cure the serious illness. It really just helps you get through and help you feel better. So palliative care it's an approach to care, and it's also specialized teams that work with your doctors and nurses to help support you and your family through serious illness. Next slide. So these are some things that palliative care teams can help you with. We spend a lot of time helping patients identify what's most important in life, and we really use that as a guide for medical care. So for someone, they might say, it's more important to me than anything than to see my son graduate from college, and that's happening 4 months from now. So we would think about how we help you get to that special moment, or taking a last trip, or reconciling with a family member. Those are things that are really important life goals, and we want our treatments to support them. We help to provide clear information about what's going on with your illness, because it can be so confusing. You might get information from a whole bunch of different sources, and it can just get overwhelming. And so we try to provide information with clear language to tell you what's going on so that you can make the best choices for yourself. We help gather the important people to talk about your condition. So that's the healthcare professionals who know what's going on and who have been involved, but also your friends and family, the important people in your life who support you. We help relieve physical and emotional symptoms related to serious illness, like pain, shortness of breath, anxiety, depression, and anything else that comes along with your serious illness. We address patients' spiritual needs, and that's really a big category that encompasses the big questions of life. Why is this happening to me? What does this mean? And how am I going to get through this? Those are really big questions that come up for people, and we see it as our job to help support people in them. We help you get connected to the resources that you need in the community, whether that's food or housing or caregiving support. There are a whole bunch of things that come up as new needs for people when they have a serious illness. We help coordinate care across different teams and settings. So if you get a serious illness, like I said, you may have lots of different people across different clinics and hospital and primary care, and you can get confused. And so we try to help make sure that nothing falls through the cracks. And lastly, and kind of our major things that we do, we help to support caregivers and loved ones, because we know that the stress of serious illness doesn't just affect patients, but everyone who's around them. Next slide. One big question is, how do I get palliative care when I need it? My best advice would be to ask your doctor or your healthcare professional. So if you're in the hospital, the best way is to ask the doctor or the advanced practice provider who's caring for you to get you palliative care. And if you're in the outpatient setting, if you're at home, then your primary care provider is a good person to ask. You can also go directly to your insurance company because your benefits for palliative care may vary depending on the type of insurance you have. And then you can go to this website, getpalliativecare.org, that has a directory of available services by zip code. I will tell you that in San Francisco, I'm really happy to say that we have palliative care in all hospitals in San Francisco. So no matter where you get hospitalized, you can ask for palliative care and you can get it. It's increasingly available also in clinics and in patients' homes. And depending on the nursing facility, it's sometimes available in nursing homes as well. Next slide. So some key take-home points from, I think, both Rebecca and my presentations, that these are really uncertain and scary times, but they're things that you can do to prepare yourself and your loved ones in case you were to get very sick. The key thing, if you remember only one thing from our presentation, is to figure out who your decision maker is and then have a conversation with that person about your wishes. Think about what would be most important to you if you were to get very sick. And if you're worried about your risk of getting very sick with COVID, I would recommend talking to your primary care provider to find out more about what you can do to prepare yourself. And then lastly, palliative care can help you and your loved ones if you're dealing with a serious illness, which includes COVID, but can be other things. Next slide.
Great. Well, now I get to ask Anne a few questions before we kick it off for other questions from the audience. But Anne, how do you find out more about risks of severe complications from COVID?
Yeah, so I think, as I said in one of my take-home points, the best way, because there's so much information out there and it's so confusing sometimes, I think the best thing to do is to talk to your primary care provider, or if you mostly work with a specialty care provider, like say an oncologist or a kidney specialist, to talk to that person about your risk because they know you and your medical conditions the best. So that's where I would start. If you're really hungry for more information, the CDC website, which is cdc.gov, has a whole bunch of information on COVID, and there actually is a specific page that talks about high-risk conditions for getting a severe form of COVID. So that's where I'd go.
Great. And then Anne, how would somebody best advocate for a client or a loved one who has to be hospitalized right now?
Yeah, I think, it can be really hard with all of the separation that happens now when you're not able to be there in person. So I think that the thing I would recommend if you want to get information or updates is to call the hospital, and you can usually actually reach the nurse who's caring for your loved one and relay a message that you want to talk to the medical provider who's taking care of your loved one. You can leave your number and times you might be available. And it's very reasonable to get an update at least once a day if your loved one is really sick. And so that's a way that you can help advocate for your loved one is by staying in the loop, finding out what's going on, and communicating what your loved one's preferences are and what you know about their wishes.
Great. And I think we now have a good 15 minutes for any questions or comments from the audience.
Perfect. Thank you so much, Dr. Sudore and Kinderman, for your presentation. We do have a bunch of questions, so I'd like to get right into it. The first one looks like a question for Dr. Kinderman. It's a listener who wanted to know what the difference, or is there any difference between palliative care and hospice care?
Yeah, this is one of the most common confusing things about palliative care, I would say. So hospice care is, at least in the United States, is a really specific type of care that's covered by insurance for people who have 6 months or less expected in their life. So if their disease takes its natural expected course, that they likely may pass away in weeks to months. So that is very different from palliative care, because palliative care is available to anyone with a serious illness, any age, any stage of a serious illness. The other thing that's different about hospice care is that hospice care is really, the main goal is to focus on comfort and quality of life for people who that's their entire goal. Whereas palliative care comes alongside people even when they're getting life-prolonging treatments or disease-modifying treatments. So, for example, we get involved with anyone in our hospital who's diagnosed with a cancer that's in their mouth or in their throat, because we know that even if it's an early stage cancer, it can be really hard to get through the treatments with radiation or surgeries or things like that, and can be very stressful. So even if we know that the illness can be cured, we help patients through that experience. So, so palliative care and hospice share some expertise around managing symptoms and caring for patients in a very holistic way, but they're really at very different stages of someone's illness.
Perfect. Thank you so much. We have another question from a listener who wanted to know a little bit more about DNR, Do Not Resuscitate. In terms of what might that entail? Say if you have a signed DNR and an emergency medical technician or a firefighter finds you and sees it, or if you arrive in ER hospital, an emergency room, and they realize that you have a Do Not Resuscitate, what does that really entail in terms of what they may or may not do in terms of treatments and interventions?
Yeah, well, and Anne, I would say please chime in here as well. But I think
Sure.
it's important to sort of think about what do we mean when we say do not resuscitate? And I have to say that is usually when someone has died, so their heart has stopped and they have stopped breathing. And then the question is, after this person has died, do we try resuscitative attempts to bring them back, or do we allow them to die naturally? So if somebody were to die and they wanted the ability to die naturally, and somebody from EMS or a firefighter or someone in the ER knew that, they would let that person die naturally. If someone were in a situation where they were maybe close to dying, but their heart hadn't stopped or the breathing hadn't stopped yet, but it looked like maybe they might die soon, any of those providers would do their utmost best to make sure that that person was comfortable, was not suffering, had the medication that they needed so that they could die naturally and peacefully. Anything to add there, Anne?
Yeah, I think, one of the things that I strongly encourage, if you have strong feelings about any treatments that you would not want in particular, to make sure that you have one of those forms. And one of the questions that came up was about a PULSE form, or a provider order for life-sustaining treatment. And it's actually a bright pink form that talks about in different situations. So as Rebecca was saying, in a situation where you weren't breathing and your heart had stopped, what would you want? And you really only have two options, which is either do kind of all-invasive resuscitation attempts, including CPR and putting you on a mechanical ventilator, all of those things, or we allow natural death. There's a second section where you can actually specify exactly the type of treatments you would or wouldn't want. So I think that people sometimes are worried that if they have specific wishes around CPR or resuscitation, that it affects the other care that they get, and it's really not the case. So it's really only your preference around that very specific procedure and how you want the end of your life to look. So that's what I would say around how we as healthcare professionals think about the Do Not Resuscitate orders or DNR orders.
I think the other thing I will say too, like Anne said, if you have been thinking about this and you know very clearly that you would or would not want, resuscitation, it's great to sort of fill out one of these forms or fill out the post or fill out an advance directive and let us know. And for those people who are listening that are like, boy, I just really don't know, it's okay. Again, because the first step is just to start talking to your loved ones, talk to a medical provider, and some of those great questions that Anne was asking, they're also in our prepare materials and in the advance directive about what are those things that are quality of life to you? What gives your life meaning? Those are things that can help us, even if you're undecided right now, because we can continue those conversations with you over time.
Perfect. Thank you, doctors. We have another question from a listener who wanted to know, in terms of certainly the kind of planning aspect of a possible health emergency. This is a listener who appears to be older, doesn't have any family, and whose friends are also maybe older in age. What you recommend in terms of, are there any different things they might consider in terms of planning for their care?
Yeah. Well, just to say that a lot of people are in that situation, and, to normalize that. And, I still think that there are some things that people can do. So even if people are older, friends and family are older, or even live in other places, in the country, what is really helpful to us is if any of those people might be someone that you think could help make medical decisions, again, thinking about who they might be, talking to them ahead of time, and you can write people's names down, including alternates. So there might be one main person, but if that person couldn't do it or wasn't available, who would be your first alternate and who would be your second alternate? So that's something that you can do. But I think for people who are worried that those people may not be available, or frankly, maybe they're just not ready to name somebody, or they don't have someone that they trust enough to really play that role, that's okay too, because we hear about that all the time. I think in that setting, it's really almost more important that those people complete an advance directive form ahead of time, and that they reach out to their primary care providers and let them know what their wishes are to make sure that it's in the medical record. We also often recommend that people keep a copy of this form with them. And again, if you ever have to come to the hospital, it's so important to keep that form with you so that the doctors really know what you would want if you couldn't speak for yourself.
Thank you so much, Dr. Sudore. It looks like we have time for one more question. I think I'd probably like to ask this one to Dr. Kinderman. It is someone who is wondering a little bit more about the difference in terms of, I don't know if you'd call it traditional care, but how might someone going into a hospital with a COVID issue, maybe more on the serious side, how might that differ if you're in, say, more of a palliative care situation versus more maybe the traditional medical care that we're maybe more used to? How do those kind of differ specifically with COVID-19?
Yeah, so palliative care, I think this is, it's so great. These are wonderful questions because these are things that come up all the time in the hospital. And I think the other, after the common confusion around the relationship between hospice and palliative care, the other confusion is that people think of palliative care as an either or, like, as the questioner was asking, what would it look like to, kind of have a palliative care approach versus a regular approach. And we're really a team that comes alongside the regular care that you're getting. So we might come alongside patients who are in the intensive care unit and are on a ventilator with COVID or with some other illness, and they might decide to continue on with treatment. But what we do is we're really helping to uncover for people who might not have completed an advance directive or not thought about their wishes in advance. We try to tease that out from the people's loved ones and their primary care, people who they might have had conversations with before about what their wishes are, so that we can provide the care that matches up best, whatever that is, whether it's aggressive life-prolonging care, whether that's comfort-focused care, whatever matches up best for that person.
Perfect. Thank you so much. I know it is very confusing, myself included. I often get palliative care and hospice care. I have a little bit of trouble trying to sort it out in my own head. So Thanks so much for that clarification. Looks like there's just about all the time we have. I wanted to save a little bit of time just to ask the doctors to see if they had any parting thoughts. Normally, I always ask our speakers if they had any couple of points they'd like to remind everybody. I know those specifically. We got those, but I guess I'd just like to ask again if there's any particular things you'd like the listeners to take home as they get back to their own lives, their own care situations, their own jobs during these kind of COVID-19 times. Anything that might be good for them to keep in mind, to keep in the back of their head, to remember based on this webinar? Maybe Dr. Sudore could start.
Sure. Well, I mean, I think first we're all in this together, and we as medical providers really want to help people and want to honor people's wishes. And I think, simple things to do to get started now, as Ann and I have been talking over and over again, is to think about who that medical decision maker can be. And then again, we have spent a lot of time thinking about the best way to create easy to use materials at the prepareforyourcare.org website, and all of those are for free. And you can use them and give them to friends and family. So feel free to use those to help you, talk to your loved ones and to help figure out what values are important to you.
And I would add, I think, this is a time of high anxiety for all of us. One of my messages is, even if you are to get COVID, your chances are much stronger that you will get a mild case and you will come through it and be okay on the other side of it. But I think that the opportunity that exists right now is that these are often conversations that are hard to have with the people that we care about. But because this is on everyone's mind right now, or it's on a lot of people's minds about what would happen if I got sick, it's actually an easier time to talk with people you care about what your wishes are and what's important to you. And that is such a helpful thing. It's really a gift to give to the people you love, to be clear about that, so that if they were ever in this stressful time of acting as your decision maker, they know pretty clearly what is important to you.
Thank you very much, Dr. Sudore and Dr. Kinderman. That is all the time we have for today. Thanks everyone for joining us. Thanks, of course, to my co-host, Luciana Tsai, and again, our presenters, Dr. Rebecca Sudore and Dr. Ann Kinderman.
Thank you.
To wish everyone.
And I think
oh yeah, go ahead.
One thing that I just wanted to reiterate, I think someone asked if there's going to be a copy of the slides, and I believe you said those will be sent out to all the participants.
Yes, we'll get a copy of the slides out and a recording of the webinar, a link to view it will in about a week. So yeah, everyone will have those. I know there's lots of notes, so hopefully no one was furiously scribbling away to get all those notes down. So yes, everyone will get a copy of the slides, and we'll also send you to a link to view the webinar later on. So again, thanks everyone for joining us. I hope you take care. Everyone, please be safe. Thanks again to our speakers and my co-host, Luciana Tsai. Have a great afternoon, everybody.
Thank you.
Thanks.